Please join me in welcoming the Mayor of Belhaven, North Carolina, Adam O'Neill.
I want to thank everybody who made the trip to D.C. I want to give a disclaimer. I am not a politician. I am not smooth. I am not funny, okay? I wish I was more so, but I'm not. We're talking about a serious issue here. And I'm foremost a dad. Secondly, I'm a public servant. That's what I do. I don't get paid a dime for being here. I don't get paid a dime when I walk to Washington, D.C. I don't get paid for this. But I got this clicker. Let me see if I can get going. Okay, there's our hospital. That's a hospital that was opened in 1949, right after World War II. That is a special hospital, not just to Belhaven, but to America. That was the first Hill-Burton hospital in the United States of America. So that's not just Belhaven's hospital, that's America's hospital. It's closed. Why? Well, back in 1949, Democrats and Republicans worked together because there was a rural health care crisis. They knew there were problems. They knew people were dying needlessly. They needed to reach out to the communities across the country. So Hill-Burton Act came about, Belhaven opened up, and there was many more to follow. That was an acute care critical access facility. Critical access. Why do they call these hospitals like Belhaven's critical access? Because they're critical. Okay? They're critical. We had an emergency room, comprehensive laboratory and x-ray, physical therapy, outpatient specialty clinics. The closest hospital to us is 30 miles away, but that's not the whole story. People to the east of us have to come 50 miles to get to us. Now they have to come 50 miles and another 30 to get to an emergency room. When we talk about impact, when I sent this slide to the Rural Hospitals of America folks, guess what? I got a phone call pretty quick. They said, Mayor, we'd like to ask you about this slide. And I said, well, that slide is important because that's equivalent to the loss of life that we're going to experience with rural hospitals failing. See, it's about perspective, it's about priorities. Our country has got the priorities screwed up. And we're going to talk about that a little bit. We've got to get our priorities straight. We're not talking about sending a man to the moon. We're talking about keeping 283 hospitals right now going. That doesn't take money like it takes to send a man to the moon. 283 hospitals now on the verge of closure. If there's just 10 needless deaths a year at each one of those hospitals, that's 2,830 people that die per year. Now, when I say people, you might be thinking of the word P-E-O-P-L-E. That doesn't have a heartbeat, does it? But you know who those people are? Your mama, your daddy, your little girl that just came out from Cub Scouts and got in a car accident and died because there was no emergency room. That's who's dying. Portia Gibbs, I'm going to talk about in a minute, who her daughter is having a granddaughter here in the next couple of weeks. She'll never see her because the emergency room is closed in Belhaven. It's people. It's real people. It's not the word on a piece of paper. It's flesh and blood. It's mamas. It's small children that the only person they have in the world is their mother, and she's gone. That's what we're talking about. It's not about the latest MRI machine. It's not about how much a CAT scan machine costs. It's about people and priorities. Think about what it would cost to fix these hospitals, and think about what our government spends on the war in Afghanistan. We have a war in Afghanistan because of this, because of terrorists, right? We're right at 2,900 people died in this attack. If we let these 283 hospitals close, we're going to have a 9/11 every year, year after year after year. Now, if somebody told the federal government that there was going to be a 9/11 every year after year after year, do you think they'd make it a priority? Well, that's what we're facing here. It's real. And I guarantee you I'm underestimating the actual toll that's going to be taken. In North Carolina, let's talk about Medicaid expansion quickly. In North Carolina, 1/10 of 1 day of the revenue that would have came to our state through Medicaid expansion would have broke our hospital even. 1/10 of one day of the revenues that our state government turned back. I'm a Republican. We got a Republican governor who's actually trying to help our hospital now, which we thank the Lord for. And we got a Republican legislature that won't expand Medicaid. Now, I'm a Republican. I would be getting attacked if there was a real good excuse not to expand it. Because I'll tell you, I've been out there. Nobody's attacked me yet. Why not? Because there is no reason not to expand it. It's almost like in a small town you have a personality conflict with somebody and they just do things just to do it. They need to stand up and do the right thing. You know? I have a lot of that too. Medicaid expansion would cover 500,000 people in North Carolina that aren't covered now. When you talk about economic loss, we had a professor at Campbell University do a study on the economic impact of Belhaven. Belhaven is 1,800 people now. The damage to Belhaven, get this, $14 million a year lost revenues in our town due to our hospital being gone. The budget of our hospital was about $10 million alone. Now, can you imagine a town of 1,800 taking a $14 million a year economic slaying? Nationally, the impact of letting 283 hospitals close, using Belhaven's projections, $4,811 million. Now, if the country had a future economic impact to rural America that was going to cost $4.8 billion, do you think maybe the federal government ought to kick up $300 million or so and make sure the rural hospitals stay in business? It's stupid not to do that. It's stupid. Why wouldn't you avert a $4.8 billion hit to rural America? Doesn't make any sense, does it? None. Does anybody here think it's a good idea to not pay $300 million to keep from losing $4.8 billion? Does anybody think that's not a good... Now, this is everybody in here. Now, to be sure, down the street at the Capitol, they feel the same way. Priorities. Priorities. International affairs. You know how much our country gave away for international affairs, or they're going to give away in 2015? Now, I know, I'm not impractical. I know that our country gives money abroad for stability in the world. And I'm sure some of those dollars are in the right spots and really are contributing to stability. But the amount of money the United States of America is going to give to other countries and other people in the next year is $27.2 billion. $27.2 billion we're going to give to other people. It costs about $300 million probably to fix our rural hospital situation. So instead of spending $27.2 billion, let's spend $26.9 billion and save 3,000 American lives, babies, 5-year-olds going to Girl Scouts, mamas, daddies, grandmamas. Why don't we do that? Does that sound like a good idea to anybody? It's all about priorities. All about priorities. I've got a video now I want to show you. Action. Action.
Adam,
Action.
move your foot or I'll break it.
Well, go ahead and
Move
break it then. Action.
He is busy.
Action. Will you come here for a second when you get done?
Would you please move?
3, 2, 1. A rough start to tonight's meeting as dozens of people, including the mayor of Belhaven, the NAACP's Reverend William Barber, and the media, were closed out of Pungo Creek LLC's meeting regarding Vidant Pungo Hospital, set to decide if Vidant violated its agreement with Pungo Creek, therefore leading to a lawsuit.
It makes me sick to even think about what Biden is trying to do to us. And I feel like we're being mistreated. I'm 77 years old. It makes me feel bad when I start even thinking about what they're doing.
Let me tell you what this man right here said. He is now a 50-year physician in our community. 50 years, 79 years old. He's the former National Country Doctor of the Year. Now, national means the whole country. All right, he's a pretty big deal. You go to his office, you can't see the paint because of the plaques. It's insane. Well, here's what he said. The closing of Pungo District Hospital has been disastrous to both local health and local economy. Patient lives and morbidity have been repeatedly jeopardized with the loss of health services and especially involving emergency room closure. Patients with emergent and emergency health conditions knowingly do poorly with uncertain transportation and long miles to receive appropriate care. Distance alone may now be 100 miles or more for treatment and intervention. Traveling extended distance for health care creates additional costs, knowing that everyone does not have a vehicle. Did you all realize that? Because they don't down the street. Do you know people don't have cars? A lot of people don't have cars. You know what it's like not to have a car and be sick and need to go to the hospital? It's kind of tough. And you know what it's like when you need to go to the hospital and the ambulances are already on runs and there's nobody to come get you? Because there's no hospital and they're having to run 60 miles round trip at least. And you're sitting there having a heart attack, got an elephant sitting on your chest, while your kids look at you in the floor hoping you're going to be okay? That's real world. Emergency medical services, including vehicles and personnel, are now in greater demand, and expenses for local emergency operations have doubled. County budgets already strained are further stressed. Above all, life is jeopardized and sickness is made worse by longer travel and added time without appropriate early medical intervention, as was available at Pungo District Hospital prior to closing. Closure of Pungo District Hospital with paralysis of health care and economic stagnation is indeed comparable to an incapacitating stroke for our town and adjacent area. That's not me saying it. 50-year doctor saying that. Now somebody needs to listen to that. Next video, please.
Let's say if one day my grandfather have a stroke, I believe he wouldn't make it to Washington, North Carolina Hospital. It would take an hour and something minutes. It would break my heart to know that my grandfather passed away on an ambulance.
There are people who would say, well, why do you guys even live so far away? I mean, maybe it's best if people just move closer to the cities. Why do you want to stay here?
Because this is home. Nowhere else in the world can you go that is like this place. We may not have things in the ways of malls, department stores, and all the modern conveniences, but what we do have is a nice, slow-paced life here. We have beauty surrounding us every day. We have the gift of our family and our friends and our neighbors that we've known our whole lives here, and it's irreplaceable. The cities get their supplies, such as food, from us. We're their backbone. We are the ones that supply them to enable them to move forward and grow and develop. If we are eliminated, what will they do?
Do you all know where your food comes from? You know, there's some kids that think it's the grocery store. You know this, right? Some kids think that where you get collards, well, y'all don't have collards up here, do you? When you talk about, when you go to get some cabbage, some kids think you get it from the grocery store, right? Well, guess what? That's not where the groceries come from. They come from rural areas. They come from the country. That's where your groceries come from. Now, none of us would be in very good shape if we couldn't eat, would we? So should rural America be losing this health care? They're actually the reason that we're all sustaining life. Maybe we shouldn't be taking their hospitals. What do you think? Probably not a good idea. We need all the farmers we can get. Now, I'm going to touch on something else that's an absolute threat to rural health care, and that's big health care conglomerates coming in and taking you over. And let me tell you something. There's some danger there. Let me tell you a little story. September 2011, our little hospital was facing a cost for some medical records software. It was really expensive. We had $1 million more assets and liabilities, and they thought, you know what? Everybody's kind of tired of messing with this hospital. There's so much work every year to keep it going. And Vidant Health is 50 miles down the road. They get all of our heart cases anyway, all of our cancer cases, all of our strokes. They deal with them anyway. Let's see if they want to partner with us. So the Vidant suits came to Belhaven and said, sure, we'll help you out. Absolutely. Let me tell you what they told us. Let's see here. This is the front page off the contract. This is the fourth paragraph. This is how it went. Whereas this formal affiliation between the parties will serve to maintain the identity and viability of Pungo District Hospital and Pungo's service area, maintain and strengthen Pungo's commitment to the community in providing health care services without regard to ability to pay, utilize the clinical components of each party to the best advantage, and enhance the delivery of high-quality, cost-effective care to patients and party service areas. Now, what does that sound like? That sounds like they're going to come in here and keep us going, doesn't it? Do you know that the head two guys, executives at Vidant Health, told me that when this contract was signed, they knew they were going to close our hospital? Didn't tell us so. Now, they said, we told y'all. Well, the doctor, the 50-year doctor there, he made the motion to go with Vidant. He didn't know they were going to close the hospital. The man who made the second was Dick Ray, longtime banker in town. He didn't know they were going to close the hospital. They came to our town under false pretenses. That's why I'm upset. Here's how it went. I was sitting in my office one day, and my phone rang. I picked it up, O'Neill and Associates. Mr. Mayor, this is WITN. We'd like to get a comment on your hospital closing. Well, now, you know, the little town I live in, we got some crazy folks there. There's 8 of them. We know them by name. All right? There's 8. All right? It ain't like the big city when you don't know who they are. There's 8. All right? Some of them I've thrown out of town meetings as many as 5 times. First thing I was told as mayor, never hit your gavel. Never throw anybody out of a meeting. Well, come to Belhaven and try to do that sometime. So anyway, I got this call, and then I reached out to Vidant. Vidant wouldn't even return my phone call. So you know what I did? I had a rally, and we like to rally down south. So I had about 300 people come up, and we started going to Vidant's tail because we wanted to talk to them. They wanted them to talk to us. So then I got a meeting with the CEO and the president, and that's when they told me, hey, we told y'all we were going to close your hospital, and we took it over. They didn't buy it. They took it over. They took it over with $1 million more assets and liabilities. This wasn't some hospital in huge debt and going under. Okay? Well, they continued right on with their process. So I had a friend in Beaufort County, the president of the NAACP. Do you know the Republicans didn't come help me? The Democrats didn't come help me? Nobody came to help me but the NAACP. I'm a Republican. Let me tell you something. Dr. Barber is a civil rights leader in North Carolina. He's your next Martin Luther King, watch, because he's real. He's real. He's not like Al Sharpton and some of these cats. He's real. All right? I'm sorry, Al, but I meant it. All right? So anyway, the NAACP filed a Title VI complaint against Vidant. And what that did is brought them to the table, negotiating table. We ended up with a mediation agreement. All right, the Justice Department sponsors a mediation due to the Title VI complaint. Here's what the mediation agreement said. Points of agreement, Vidant Health. Vidant will transfer ownership of intangible operating rights and the tangible operating assets necessary for the continued operation of the Vidant Pungo Hospital to a newly created legal entity more particularly described herein, Pungo District Hospital Community Board, which will become licensed and certified operator of the hospital on or before July 1st. Now, the way I read that, it says intangible and tangible. That covers everything pretty much, right? Because you only have intangible and tangible, right? I mean, I went to NC State. We get picked on a lot for cows and things like that, but I'm thinking that's what that means. Well, about 2 weeks into this agreement, Vidant's attorney calls our attorney and says, you know, cash on hand, accounts receivables, medical record systems, they're not really assets of the hospital. So just as soon as the federal mediator got out of town, they went to carving on us again. And you know that $1 million we pledged to you that we were going to give you July 1st? Well, we're going to add some stipulations to that. So then they went and undermined our mediation agreement. And then when they closed our hospital on July 1st, they said it was the town's fault. The town just couldn't get their stuff together. They didn't bring up that they did data dumps on us. We had evidence that they held information 2 weeks on us, playing games with us. Because they're going to run us out of business. They're not worried about the mamas, the daddies, the little girls, The elderly people that are going to die, they don't care about that. Now, you might say, Adam, look, we know it's sad. That's a sad story. But Vidant Health probably had bad years. They were probably struggling. They probably had to make adjustments so that they could survive the overall, the whole. They had to look after the whole. Okay. They closed our critical access hospital. In a year, they made $109 million. They're a nonprofit. They increased their reserves by $109 million. The year before, they increased their reserves by $127 million. And they've got $700 million in reserves. And they're going around and closing critical access hospitals. Does anybody think that you should be closing critical access hospitals with $700 million in the bank, most of it due to government funds? Does anybody, I want to see that hand. Is anybody in here? I'm glad I don't have to fight. That's good. All right? I mean, think about that. They're lost. Listen to this. Their CEO made more than twice what our hospital lost in a year. One man made more than twice what our hospital lost in a year. Does anybody think that's okay? And closed a critical access hospital. And they don't like me out here talking to people like you. I basically got threatened the other day. Their attorney is calling our attorney and saying things that probably shouldn't say. But I ain't shutting up. I'm going to keep right on telling the story. Because I believe in America, when enough people find out the injustice that's going on, they'll do something about it. The governor of North Carolina is trying to help us now. Now, the other thing I want to point out is this. Your rural hospital, when the conglomerate comes to you and says, you know, you're losing too much money, all right? Well, I want you to think about something. The last year, Vidant said they lost $1.2 million on our population of northeastern Beaufort and Hyde counties. Now, let's think about that for a minute. First off, they were practicing planned obsolescence, okay? They were trying to run the expenses up to make a big show, say, hey, you're losing too much money, we've got to close you. Now, guys, let me tell you why they were doing that. Because they owned Washington 30 miles away, and they figured if they closed our hospital, all those people had to go to Washington. They didn't care if people died trying to get there. They just knew they could make more money, get some bigger bonuses. That's all they were thinking about. But did they really lose $1.2 million on our people? And all of you need to hear what I'm about to say because you may not have thought about it. On the population that was served by our hospital, they made millions off of us. Because every stroke, every heart attack, every car accident, everything came to us and then went to them and they made a bunch of money. So they're saying, look at all this money we made. They're making it off the backs of us in many cases. That's wrong. That's wrong. And when you have an immoral board, greedy board like Vidant has right now, then you got problems. There need to be laws against that. There needs to be a law that if someone defrauds or takes away emergency services from a community under false pretenses, it needs to be a criminal offense. Because people die. When you do something like Vidant did, that CEO should go to jail. And we can prove what I'm telling you. I got a packet of 6 lies, the big lies that Vidant's told, with DVDs, audios on lies showing that they're lying. I just sent it to all the state legislatures in North Carolina last week. Got kind of a storm going on up there. Vidant's not happy about that, but they did wrong. They need to come to Belhaven and they need to fix what they tore up. It's going to cost us $6 million to get our hospital opened back up. We're working on it. We just hired a management company. We're working with the USDA to get a loan. We've got Vidant sued, but you know what they're going to do with us suing them? They're going to drag us out in court as long as they can. They got $700 million in the bank. They got those fancy lawyers. But guess what? We found us one too. Let me show you what really looks sad. You see that right there? In Belhaven, if you're having a heart attack and you go to the hospital, that used to say emergency. Now guess what? You see that little sign below it, the little white sign? It says, for emergencies, please call 911. Right at that sign, you used to get the shot for the heart attacks. You used to get the CAT scan to see what kind of stroke you were having, to get you whatever medicine you needed. All that used to happen right there. Now you got a half an hour to an hour wait. So you all are health people. You know what happens with a stroke, another half hour to an hour. You know what happens with a heart attack. That's what our emergency room looks like now. That's like looking at a dead person, because it means dead people. Next video, please.
The EMTIs or EMTs, what,
Paramedics.
every one of them that was in there that worked on my wife, I feel that they done everything in their power to what they could do.
I mean, I don't blame anybody that worked on Mama. They did what they were supposed to do. But it's the fact nobody has the right to say, well, my mother would not have made it.
She didn't have the opportunity because Belhaven was closed.
That's right.
So because there was nothing in Belhaven.
If we were the first ones to have this problem for Belhaven being going, who's going to be next?
Exactly.
I was still in shock. I just couldn't believe it. She, like I said, that morning we were all fine. We were all laughing. We were having, I just cleaning the yard, talking, joking, and it was just out of the blue. It was just gone.
I wasn't there. When my mother started having an attack, it was basically like she had a low blood sugar. So sometimes when that happens, she does faint unless she gets some like sugar in her body that she can eat or drink or whatever. So when that first happened, I thought, well, maybe she'll be okay. They just need to take her to the doctor to get her some insulin and she'll be fine.
They had just closed the Belhaven Hospital. The fact of the matter is we don't know if it would have held, but we'll never know now.
This is Portia Gibbs right here. Portia Gibbs. She's about 48 years old. Her daughter is having a baby in 2 weeks. Portia won't be here. Okay? This is real. This is real. She spent the last hour of her life in a parking lot in Swanquarter, North Carolina, waiting on a helicopter. Do y'all realize that helicopters don't fly all the time? Huh? We got a helipad. Well, half the time that's good. Be better to have an emergency room physician there. But you know, helicopters don't fly sometimes. She was up, she was talking to the paramedics and fine. About 20 minutes into this hour, all right, fine. Now, if she'd been to the ER, what would have happened to her? But Belhaven was closed. She was 25 minutes from Belhaven. So they knew that it would be better to call the helicopter than try to get her all the way to Washington. So they called the helicopter came in an hour. The helicopter was landing as she passed away. She could have spent the last 35 minutes of that hour at the hands of an ER physician with all the tools that he had. But instead, she's dead today, and we got a granddaughter being born, never meet her grandmother. That's what we're talking about, people. That's why I walked to D.C. This right here is why I walked to D.C. I was at a county commissioners meeting. I was speaking. It was halftime. They take a dinner break. And I got a call from the 50-year physician, and he said we had our first person die. It was in the 1st of July. And I told him I'm going to walk to D.C. Because once again, I don't believe in America, if people know what's going on, they let this kind of stuff happen. It's like these rural hospitals. We've got to get serious about this. You can't just sit around and push paper. All right, you see this little girl right here? That's the little girl of a lady who helps us with our efforts. She's actually a volunteer fireman or rescue person. Now, imagine that little girl getting hit by a car, falling off her bike, hitting her head, and that little girl dying. Do you think that's going to cause any problem in that community? Now, I can tell you this, when that happens to the right kid down to that Capitol, somebody will start doing something. Well, this is just a kid. This is just somebody's kid, like your kid. And this kid is at more danger than she's ever been at. See this one? I get choked up sometimes. That's my kid. I only have 4. That's my youngest. That's her birthday dinner about a week ago. All right? Does she deserve emergency care? Am I supposed to stand by and let crooked men come to our town and steal our emergency room away and put little kids like that at danger? Am I supposed to do that? What's my responsibility as mayor? Am I supposed to fight or am I supposed to sit down? That's what I'm doing. Now, I'm going to ask for something that's a little out of the box here, because you can't get things done in this world anymore staying in the box. You can send all the letters to your congressman you want to. Do you know what politicians react to? Squeaky wheels. They don't like squeaky wheels. Let me tell you something else they're scared to death of. Whites, blacks, Latinos, rich, and poor getting together on an issue. That is scary stuff. That shakes them up. I'm telling you, it shakes them up. And here's what I want to propose, and I'm going to put the National Rural Hospital Association on the spot here. I know for certain, for 100%, without a doubt, that there's something we can do to fix this problem. It will take 2 weeks, and it will fix this problem. It will make this problem the national issue in this country. This will be bigger than Afghanistan. It will be bigger than anything going on in this country. And you know what that is? That's organizing another walk from Belhaven to Washington, D.C. with a member of every one of these 283 towns and communities. Not a walk of one small town mayor and a civil rights legend, Bob Zellner. God bless Bob Zellner. Not just 2 guys with some folks coming up, but how about a walk with 250 or 300 people? How about if each one of these communities can find one person that is committed to not losing their hospital to the extent that they'll take 2 weeks and come walk with me? I'll guarantee you, we had all this national media. I was on media yesterday. I'll guarantee you, NBC, CBS, ABC, CNN, Fox News, it'll be the biggest things ever hit the world in this country. It'll be like going back to the civil rights days, except instead of getting beat up or shot at, we'll make it. And let me tell you something else. When you start putting this walk together and you go over there to talk to the Capitol and they know you're about to take off on a walk, you think they're going to talk to you? Oh yeah, they're going to talk to you. They're going to say, what do y'all need? What do y'all need? And if they don't do it, then we just start walking. And by the time we get to D.C., I'll guarantee you we'll have this problem fixed. It's one way or the other. But you got to think out of the box. I can tell you in Belhaven on July 1st when our hospital closed, July 2nd I made some calls. You know what everybody said? Sorry. You know, you did your best. You know, nobody can fault you, Adam. You did your best. Good luck. You know, I'm sorry for you. When I got done with that walk, the governor sent his man down. We'll do whatever you want to do. The congressman started getting involved. Everything started happening. USDA said, let's help you. Everybody got going. That's what we need in this country right now for rural hospitals. Because we're talking about losing 3,000 people a year that are our kids, our elderly, our parents, our mamas, and our daddies. And it's worth doing it. But you got to be willing to do something. And you got to be willing to think out of the box. So I'm going to be the first one to sign up for that march. I don't know what the date's going to be. I hope the rural hospital will take my invitation and help coordinate it. Because I'll guarantee you, it'll get more PR than you're ever going to have in your budget for the next 10 years. Let me tell you. That's pretty much all I got to say. I just want to say you need to think about fighting for this like those little girls' lives depend on it. Thank you.
Well, let's let everyone give you a standing ovation first. Hold on. I've got some questions here. We'll have time for a couple questions for next one.
I want you to do that walk. Let's put it together.
I will be there to march with you. Thank you.
CEO of a hospital in northern coastal California in Humboldt County. I'll be there with you.
Amen. There you go. That's what we need. That's what it takes.
Hi, I'm Hilda Hetty. I'm a former CEO of a small rural hospital that almost closed in 1988. And the community came together. We passed a special tax levy to keep that hospital open. That hospital was purchased by a large conglomerate 6 months ago. And I've got a terrible bad knee, but I'll march with you.
All